Today I'm going to share with you the case study using an integrated knowledge translation approach to better understand the impacts of adverse childhood experiences among adult primary care patients, also known as the EMBRACE study. ACEs are recognized as determinants of poor health in adulthood and risk factors for chronic health problems, such as chronic disease, mental illness, health risk behaviors, and rates of healthcare utilization. Unfortunately, current practices in primary care settings do not routinely address ACEs, and that's why the EMBRACE study was formed. The EMBRACE study is a multi-phase integrated knowledge translation initiative established in 2013, and it's funded by the Poole Foundation, which is a private foundation supporting knowledge mobilization and applied research into the science of early brain development and its impact on lifelong health. Their collective goal is to conduct research to complement and build on existing trauma-informed policies, programs, and practice within primary care settings in Calgary, Alberta. To accomplish this goal, the EMBRACE study aimed to address three primary objectives. The first objective was to identify a clinically validated tool to measure patient ACE history. The second objective was to evaluate the associations between ACEs and health outcomes among diverse primary care patient populations. And the third objective was to develop and test a clinical treatment program aimed to improve health outcomes among primary care patients with a history of ACEs. Through their initiatives to accomplish these objectives, I noticed some major themes that were attributable to their successes. One being, they built a diverse team that was unified in their goals, and they had continual involvement of the team throughout the study and extended their reach of their findings by using dissemination approaches that were just as diverse as their team. The EMBRACE study first started by forming a diverse team, including various healthcare professionals as listed on the slide. The team also included a group of primary care patients that were actively involved in the development, implementation, and evaluation of each phase. And another step can be taken to include multi-jurisdictional teams, just like what was done with the SALTI project. This project was developed to address complex and pressing challenges in long-term care and was made up of 4 multidisciplinary teams from across Canada. So once a team has been established, then you just have to make sure that everyone can work well together, and that comes to unifying the team. So one of the major considerations there is to have an openness for what constitutes expertise and knowledge. Every member of the team has their respective expertise and knowledge that they can contribute, and a respect for and balanced representations of all forms of knowledge and expertise will result in more relevant, useful, and applicable outcomes. So this goes a long way in empowering the team as well. And although this all sounds great, there are some determinants of coalition that should be considered. These include communication, conflict resolution, commitment to collaborative efforts, perceived benefits, and formalization. And this is where it becomes important to define the rules and expectations to prevent conflict from misconceptions later on. But that leaves us with the important question of how do you build a multidisciplinary team? So CIHR recommends engaging in critical examination and reflection of the context and environment in which the research can take place. And this helps to determine which partnerships would be beneficial. So you can do this by looking at your own or your coworkers' prior working relationships with different knowledge users. You can search websites for potential partner organizations, attend events and meetings with like-minded groups. And it's good to get involved in knowledge user causes and issues, like helping them with other research projects, making linkages to other people in your network, and assisting with literature reviews. So with the EMBRACE study, an important partnership that was developed was with the Poole Foundation, who provided the funding, but also input at the initial proposal for the study. And this relationship was built from team members participating in a knowledge mobilization initiative that the Poole Foundation had. And they had similar goals, so they decided to collaborate. And what's interesting is one of the staff members from the Poole Foundation continues to sit on the research team to actively contribute to the work, which is a great example of having continuous involvement. So this is another important aspect to the study success. So they had frequent monthly team meetings, and this is also in the literature a lot as well. Whether they're in person or virtual, they enable the teams to discuss priorities, study progress, develop research questions, interpret the findings, and discuss relevant literature. They are also beneficial for maintaining team cohesiveness and momentum for the study. And more recently, studies have included knowledge users more throughout the study. So with the Embrace study, they included a patient group in the monthly meetings where they could share their input for the research questions, the study methodology, and data interpretation. They also had focus groups 3 times a year with this group to gain their insights on how ACEs have influenced their health, their experiences within healthcare settings, and their reactions to the study materials like questionnaires, recruitment materials, and draft treatment protocols. So with continuous involvement of the researchers and integrated knowledge users, they can jointly interpret the data, agree on final results and key points, and then craft the message for different audiences, which allows for a diverse approach to the dissemination of knowledge. So when looking at dissemination, you need to consider your objective, the audience that you're looking for, when you'd like to get this message out by, and what resources you have, because they'll shape the strategy that you use for dissemination. So some of the strategic decisions you have to consider are including partnerships. So just like the Embrace study with the Phalanx Foundation, that was a very important part of this project. And deciding what the main message of the research findings are and how to frame it for your audience, as well as what channels you're going to share the message. So for example, conferences, journals, and social media platforms. So some of these were used within the Embrace study. So they had the clinically validated tool, they had published papers reporting their results, they attended national and international conferences where they also included live or recorded videos from patients. They also organized a conference with help of the Phalanx Foundation in Calgary, and they had over 300 healthcare professionals and internationally recognized experts interested in the effects of ACEs all attend. They also used forums to help with supporting partnerships and hosted a formal luncheon with stakeholders, patients, and health professionals where they were all invited to learn about and discuss the study's latest findings. So the Phalanx Foundation partnership was a huge asset for the Embrace study, and they were able to build connections and extend their efforts beyond that with more knowledge mobilization strategy sessions hosted by the Phalanx Foundation, so similar to the one where this initial connection was made. And these sessions were used to help foster change agents. So those are individuals that can help to motivate, inspire, catalyze, and potentially lead to a change in processes in the hopes of a positive outcome. So to revisit the themes, it's important to build a diverse team that's unified with a collective vision, and to have monthly meetings. It seems to be a good frequency to have them to keep the momentum in the study and also the cohesiveness amongst the team. And with collaborative efforts to develop relevant outcomes, diverse approaches to dissemination knowledge should be used to reach more people with the findings. And to help further IKT research, more of an emphasis should be placed on how to build the IKT team. There was limited resources posted about that, and there should also be some more transparency with what has worked and didn't work for other groups to help improve the quality for future IKT approaches by providing recommendations for how to maintain continuous involvement and also how to disseminate the findings to have the most impact. Thanks for your feedback.